Right now it is 11:33. You were taking a live look over the Country Club Plaza right here in Kansas City, and as you can see, it is starting to fill, and it's also starting to smell just like spring outside, just a tad bit gloomy. And with spring comes sports injuries, especially after a long winter break. We've all been stuck inside. I'm Janae Hancock here at the live desk, and today I am actually joined by Dr. Mary Devers, who is the medical director of Care Now at HCA Midwest Health. Doctor, thank you so much for joining me here at the live desk. I want to jump straight into it. You're a familiar face here at KCTV5 to start off, but this time of year, safety is top of mind for a lot of parents, and kids are getting back out there enjoying the beautiful weather and the beautiful temperatures as well. But there are some common injuries that come with spring sports and spring activities. Tell us a little bit more about that.
That's right. There are a lot of common injuries, more than you'd think. Actually, nationwide, about every 30 seconds or 1.35 million times a year, a young athlete suffers a sports related injury bad enough to go to an urgent care center or even emergency rooms. At our Care Now centers, we're already experiencing a big uptick in the number of kids, weekend warriors, pickleball players all coming in, and we do expect this will increase as the weather improves.
Let's go straight into what the common injuries are. What should parents be looking out for in their children, even in their teens?
Yeah, absolutely. With our youth injuries, including everything from slight concussions to foot and knee injuries, we see sprains, we see strains, even minor fractures, all of which can be very painful. One of the reasons we urge our community to seek treatment when the pain doesn't subside is the risk of the injury becoming more serious. Additionally, young kids are still growing, and intervention and treatment of those injuries will help heal and protect that growth. Playing through the pain, however, can lead to fatigue, poor technique, ultimately more significant injuries. So it's important to make sure your kids understand that they should talk with you and seek help if they're experiencing pain or something that doesn't feel right.
And you talk about seeking help and treatment as well. I think where a lot of questions come in is what is the difference between going to urgent care and then also going to the emergency room? When should you go to either one?
Yeah, certainly for more severe injuries. If you have a concussion or head injury where the athlete has lost consciousness, yes, go to one of the urgent emergency rooms. That's more appropriate. However, for sprains, strains, minor fractures, bruises, certainly urgent cares are not only capable of providing that care, but giving you an affordable option for treatment that can't wait for a scheduled appointment with your primary care physician. Typically, urgent cares, including our urgent cares, do have x-rays, lab services, and licensed providers who can perform minor procedures like suturing.
And you brought it up just a little bit, but I do want to bring in this video. Taking a look at our screens right now, we know just within the last few years, the sport pickleball has become really popular, not only here in our community, but across the nation. So for adults as well, what should they be on the lookout for as far as pickleball injuries are concerned?
Oh, yes. We were talking about youth earlier. Now we're talking about the adult population, and it's usually due to overuse or sudden significant use of muscle and body parts that have kind of been in hibernation over the winter and just aren't quite ready in shape for that level of play yet. A recent study actually found that patients 50 years and older accounted for 90% of patients hurt while playing pickleball, mostly with sprains and strains, but there certainly can be fractures as well. So while pickleball is a great, fun sport, not to mention a fun social setting, those playing should be aware of the risks and take preventative tips seriously.
All great tips there. Now, Doctor, let's talk prevention. I know we love to see you, we love to talk to you and get those tips on how to stay healthy, how to stay safe, but we do not necessarily want to go to urgent care, especially with the beautiful weather outside. So tell us a little bit more about those prevention tips.
Absolutely. It's a favorite subject. Prevention takes time, but it's often free, it's easy, and just takes a little bit of dedication, but it is so important. So certainly stretching and warming up is key before you're playing any sport. Incorporate a strength training and flexibility exercise regimen throughout the week to maintain muscle strength and maintain joint mobility. Also, very important, drink water before, during, after any sports activities. Muscles generate heat that raises your body temperature. When the body gets too hot, it sweats, and evaporating sweat works to cool the body down. So if you don't replace the water lost by sweating, by drinking and rehydrating, your body can then overheat. And make sure you also don't just push yourself too hard while playing. Slowly, gradually increase your intensity over time.
we all want to have a great season, especially as we look ahead to warmer temperatures with the summer season coming up in just a little while. Dr. Mary Devers, a medical director of Care Now at HCA Midwest Health. Thank you so much for joining me here at the live desk today. And for more stories like this one, you can go to our website, kctv5.com. You can also download the KCTV5 News app and click on It's Your Health.